Well, tomorrow is open enrollment. The country's healthcare system is mired in uncertainty on the eve of Obamacare's open enrollment tomorrow. President Trump's stalled agenda on tax reform is pushing healthcare back to next year. Premiums are still soaring. Estimates show that Obamacare enrollment has dropped anywhere from 800,000 to 1.6 million during the sign-up season. We want to bring in the CEO of the Mayo Clinic in Florida. He's vice president of the Mayo Clinic, Dr. Gianrico Farrugia. Dr. Farrugia, good to see you. Thanks so much for joining us. We are here in this period right ahead of open enrollment. Characterize the situation for us.
Well, we really are still in a period of great uncertainty. We're still not quite certain where things will go. So we've taken a step back and said, okay, what do we know? We know that patients want access to high-quality health care, and they want to be able to get it when they need it. And if you look at it that way, then you have to really start planning on the next generation of healthcare. And that requires you to make sure that we introduce regulatory reform into the system and we continue to fund the National Institute of Health. If you take the National Institute of Health, I'm a physician scientist. I've been funded for 23 years. I can tell you firsthand how important it is for the NIH to keep getting funded so that we can take those discoveries and then work with private companies and actually make them relevant for our patients. Regulatory reform, on the other hand, a primary care physician is now spending only 27% of her or his time with patients. 46% of their time is spent on paperwork.
Wow.
It's estimated that 15 to 20% of the spend on healthcare goes to compliance and billing. We've got to be able to reduce those if we want to remain a global leader in healthcare. We've got no choice.
What would you like to see happen in the prescription drug area? You know, there's a lot of attention actually in Washington, D.C. on the pharmacy benefit managers. Do they really add value? And what do we need to do with NIH and Health and Human Services to streamline the approach on prescription drugs?
So that question has many levels to it. The first level is we need a pipeline. So investing in areas like precision medicine is very important. There's an area of precision medicine called pharmacogenomics, which allows you to give the right drug to the right person at the right time. So that kind of investment is essential. Then we have to look at the pathway towards bringing a drug to become available for patients. And that pathway goes through the FDA, and we need a strong FDA. There's no doubt we need safety. But on the other hand, there are other regulations that get in the way, and those are the ones we have to focus on. Let's not focus on the ones that change safety. That's a very important thing for our patients. But let's focus on the other hurdles that we can get rid of.
Doctor, when you look at the CVS-Aetna deal, I mean, are we changing the model as a result of Obamacare, or is just the way the population wants health care, is that sort of what's changing the model?
There is a component of Obamacare. But as you know, retail is playing an even greater role in healthcare.
So it's an Amazon story.
Well, it's a blue whale story in that way, that, you know, when a blue whale enters the field, you've got to do something about it. But it's also the fact that, as you know, CVS needs to have people walk through their stores. This is one way of doing it. Right. We do know that a company like CVS has many different ways of touching a consumer, and a company like Aetna needs to be able to touch the consumer when they try and reduce healthcare costs. So it's a question, so it's really that, and then consolidation continues, and this is just another example of consolidation. That's a pathway that Mayo has not taken, but it is a pathway that many companies have.
And providers are becoming more and more retail in terms of how they touch their customers? Is that also...
Well, you can flip it and say consumers and patients want to have a more retail experience when they experience healthcare.
Very interesting. Dr. Farrugia, good to see you.
Thank you.
Thanks so much for weighing in this morning. We appreciate it. Gianrico Farrugia there.